Okay, so if you've been looking into an embolization procedure, I wanted to show you as an interventional radiologist how we actually get there and how it's done through a pinhole. I've got a couple of little things to show you here. This is called a catheter, which is a flexible plastic tube, which normally would enter the body in the wrist or the groin. I'll show the wrist because it's easier. You can see this is quite long. We can really get anywhere in the body, and surprisingly, the only little discomfort would be a mild little pinprick, much like having a blood test, just to numb up the area over the wrist artery. And then it's possible to enter this blood vessel and travel without pain or any feeling through the body, all the way from the wrist down into the liver, the uterus, or even the prostate. And then when we get to the target organ, we'll go through the middle of this little tiny tube with an even smaller tube called a microcatheter here, which is very flexible. You can see this microcatheter can wrap around my finger and still stay intact. And that will allow me to get further still into the tiny blood vessels that we're targeting and inside the target organ, be that the prostate or uterus or liver, and deliver the therapy. So this is how, through a tiny pinhole on the other side of the body, we can target the organ and the inflammation or overgrowth process that we want to slow down and deliver the treatment to the spot. And that's done using guidance with an X-ray and CT scan for three-dimensional information and X-ray dye, so we know where we are inside the blood vessels at any point in time.